Thanks for watching. Let's talk about Latuda or lurasidone. This is an atypical antipsychotic. It was approved in 2010 by the Food and Drug Administration for treatment of schizophrenia, in 2013 for treatment of bipolar depression, not mania, but bipolar depression, either as sole therapy or as an add-on therapy for adults. Then in 2018, the FDA said, you know, it could be marketed for bipolar depression in the adolescent population in people between the ages of 10 and 17. Fairly popular medicine. It ranks in the top 250 of all prescription medicines, slightly more than 2 million prescriptions written each year. The drug company is trying to boost sales, so you might see some advertising because it's going to lose its patent exclusivity in 2023. And the company wants to have sales at the peak by that time. Well, the current indication, schizophrenia, for adults or adolescents between 13 and 17 years of age, or bipolar depression, not the mania, but the depression, in adults could be monotherapy or as add-on therapy to lithium or valproate, or it could be used in the pediatric population, in the adolescent population, as monotherapy. Schizophrenia is an important disorder. Affects about 2.5 million people in the United States. That's about 1% of the population over age 18. It's a chronic disorder. About 80% of the people are going to recur, and it's associated with the 50% increase in the mortality compared to the general population mortality because of either suicide or violent death or cardiovascular events or obesity-related metabolic problems or poor lifestyle. Well, the big market, however, is in bipolar disorder. Bipolar disorder, by some estimates, might affect as many as 12.5 million people in the United States, but the National Institutes of Mental Health says, nah, that's not true. It's only about 2.5% of the population, but that's still about 5.5 million people. The median age at onset is about 25. About 50% of adults with symptoms of bipolar disorder had their first symptoms that developed prior to age 18 but weren't diagnosed. But even so, somewhere between 1.5% and 2% of the pediatric population is currently diagnosed with the bipolar disorder or suffering from bipolar disorder. Significant increase in the risk of hospitalization with bipolar disorder compared to a variety of other psychiatric diseases. And as with most psychiatric diseases, if you have bipolar disorder, you have other conditions most likely as well. So you suffer from anxiety or panic or eating disturbances or substance abuse or have an increased incidence of suicide. Well, let's look and see how the medicine functions. First, we'll take schizophrenia. Schizophrenia is rated by what's known as the PANSS. It stands for the Positive and Negative Syndrome Scale. And it has a rating anywhere between 30 and 210. 30 if you're normal, 210 if you're as bad as you could possibly be. There are other rating scales used as well. So this drug was approved on the basis of 5 studies in adults, each of which lasted 6 weeks in duration. The number of people in the studies, anywhere between about 150 and about 500. Those people were divided between the different doses of the medicine and placebo. And in 2 additional studies, and 2 studies altogether in the group, they also took the generic form of either Seroquel or Zyprexa as a comparator. Well, let's look at the largest study. In the largest study, the PANSS score was about 96. That means the patients were markedly ill. After they had taken the medicine at 40 milligrams, the score fell 19 points. That wasn't statistically significant, different from placebo. If they took 80 milligrams, the score fell by about 23 points. That was statistically significant. If they took 120 milligrams, wasn't as good as if they took 80 milligrams. The score dropped by about 20 points, but not statistically significantly different from placebo. And the placebo, it dropped by about 17 points. So all of the people still had a rating somewhere between 70 and 80. Well, remember, 30 is normal, so these people certainly aren't normal. All of the scores led to change, and the change typically would go from marked disease to moderately ill. Patients were not resolved. Now, the European Medicines Agency considers a 30% decline as clinically relevant. And in the studies, taking the drug, the people score on this test fell by about 50%. But if you took the placebo, it fell somewhere between 30 and 40%, and the dropout rate, so the people who were taking the medicine stopped taking it, somewhere between about 30 and 40% of the time. And we don't have any evidence of how the people who were taking the medicine actually functioned in the real world. So in some of the tests, the 40 milligram, the 80 milligram, the 120 milligram, 160 milligram dose all showed statistically significant improvement in at least one of the studies. But interestingly, the Seroquel generic and the Zyprexa generic showed even a smidgen more benefit than the Latuda. But remember, these are just scores. They're not indications of how the patients are functioning in the real world. So just like you can have somebody who takes a test and does very well in school and doesn't really know anything about the topic, can't apply the information, that's kind of what we have here with some of these tests. And more importantly, the studies are funded by the drug companies, and sometimes the employees of the drug companies are members of the panels that are writing the papers. Now, even worse, the studies are what we call multi-center. Now, if we have a multi-center study and it looks at people in Seattle and Chicago and St. Louis and Miami and New York, that's kind of what we think about. But no, the studies here, when we talk about multi-center, the studies were in Peru and Ukraine and Lithuania and India and Colombia and Romania and in Russia. They were in Slovakia and Bulgaria and Serbia and Hungary. Not places that the drug company can really have good feeling for how the patients are being treated and how the patients are being evaluated. Well, let's look at a comparison of 15 different antipsychotic drugs. And when we look at them, it seems Latuda doesn't do very well. It actually ranks second from the bottom as far as the changes on the PANSS score were concerned in the brief psychiatric rating scale, other kind of scale. So patients are more likely to put up with some of the negative side effects if the medicines work better. But actually, if we look at the all-cause discontinuation rates, Latuda didn't rank very well. It was third from the bottom. So if we look at the weight gain on taking the medicine, it was actually pretty good. So you don't gain a lot of weight while you're taking the medicine on average, but you have more restlessness than most of the drugs. So how did the studies do on bipolar disorder? Was it any better than the schizophrenia? No, not really. So the study, one study is monotherapy, looking at less than 500 patients for 6-week duration. Again, multi-center. They used the Montgomery-Asberg rating scale. It's a 10-item scale. What did they find? Found the patients did okay, not great. Then they used as an add-on, what they did is they got them stabilized on valproate or lithium, and then they randomized them to either the placebo or Latuda. That was a study that involved 340 patients. And what they found was basically that the low dose of 20 and 60 milligrams seemed to do better than the higher dose of 80 and 120 milligrams. Had modest improvement, not marked improvement, but modest improvement in the scores. And the patients at the end still had their depression. They weren't cured. The pediatric population, if we look at them, 25%, 1 in 4, suffered from headache, and 1 in 6 suffered from nausea. Significant dropout because of the side effects, because the patients didn't want to continue taking the medicines. And remember, we have 6-week studies for disorders that are going to last a lifetime. So, according to the drug company, the effectiveness of their medicine for more than 6 weeks has not been established in clinically controlled studies. So the package insert advises that we need periodic reevaluation of the usefulness of the medicine in patients. Now, if you're going to take the drug, you should take it with food, somewhere between 350 and 1,000 calories, independent of the fat content of the diet. seems to increase its absorption if you take it with food, increases absorption by somewhere between 2 and 3-fold. You take the medicine once a day. If you have schizophrenia, the starting dose is 40 milligrams, adolescents or adults. Maintenance dose for adults, 40 to 160 milligrams, 40 to 80 milligrams for adolescents. If you have bipolar disorder, bipolar depression, you start at only 20 milligrams. The maintenance dose for adults, anywhere between 20 and 120 milligrams, but it seems that 80 or 120 milligrams isn't any better than 20 or 60 milligrams. Adolescents find basically the same thing. The overwhelming majority are taking either 20 milligram or 40 milligram. It seems that the more you take doesn't necessarily mean the better you get. Now, if you happen to have moderate to severe renal impairment, then you should start with a lower starting dose, 20 milligrams for schizophrenia. Maximum dose should be 80 milligrams. If you have a problem with your liver, moderate problem with your liver, you take a maximum of 80 milligrams for schizophrenia. Severe impairment of your liver function, you only take 40 milligrams maximum dose. And if you're taking other drugs, other medications, maybe you're taking a medicine for infection, maybe you're taking some clarithromycin, maybe you're taking a medicine like ketoconazole or itraconazole or any of an enormous number of other drugs, well, those drugs can inhibit an enzyme in the liver known as 3A4, and that's a drug metabolizing enzyme. And if you inhibit that drug metabolizing enzyme, your body can't get rid of the Latuda, so you need about a 50% decrease in the dose of the Latuda. So you would start at, say, 20 milligrams and go to a max of 80 milligrams for schizophrenia. Now, there are a lot of warnings about taking the atypical antipsychotics, including Latuda. So the drug is not for elderly who have dementia-related psychoses. So people who have hallucinations or delusions, who are elderly, who have dementia. And it seems that the drug family, these atypical antipsychotics, over a 10-week time period can increase the death rate by about 60 to 70% compared to placebo, mostly from cardiovascular events like heart failure or sudden cardiac death or infections like aspiration pneumonia. Can increase the suicidal thoughts and behavior, especially in the pediatric population. Young adults prior to age 24 seems to stabilize after age 24, but higher risk, so you have to monitor people, especially when you start the medicine or when you change the dose. Can increase the likelihood of stroke and transient ischemic attacks. Some people call them mini strokes or TIAs, especially in elderly who have dementia-related psychoses. Tardive dyskinesia, well, those are potentially irreversible, involuntary, atypical movements, typically of the face, but could be of the extremities. So it could be with your lips just moving like that, or darting your tongue out, or your eyebrow twitching. Seems the higher the dose, the longer you're taking the medicine, the greater your risk, especially if you happen to be an elderly woman, but can occur in anybody, even taking it for a short period of time. So with the medicine, you want to take it for the shortest period of time that you can at the lowest dose. Unfortunately, if you develop the tardive dyskinesia, it doesn't mean that when you stop the medicine, the symptoms are going to go away. They often don't, and can interfere with the hormone system. There's a chemical that the brain produces known as prolactin, an increased level of that in about 1 in 16 people. And the elevated prolactin interferes with the pituitary gland, sending messages to the ovary and testes to make the sex hormones. And as a result, we have a decrease in reproductive function in both men and women. We have lactation or galactorrhea, production of breast milk. Women can develop amenorrhea. In prepubescent boys, they can develop enlargement of the breast, erectile dysfunction in adult men, a decrease in bone mineral density, and about a third of breast cancers in the laboratory seem to be prolactin dependent. Human data we don't have, but that's something to be concerned about, especially because breast cancer is obviously such a significant issue. It can also decrease the white blood count, decrease the white cells that fight infection. We call them neutrophils. Sometimes lead to agranulocytosis, where you just don't make any of them. Special cautions necessary if you have a low white count to begin with, or if you have a history of a low white count due to some other kind of medicine. And that means if you have a fever, if you have some infection, you might need to go get a checkup because it might be because the problem is with your cells. Now, if you take the medicine and stand up, then you could develop a condition that we know as orthostatic hypotension, where your systolic blood pressure, the top reading, falls by more than 20 points when you stand up, and your heart rate goes up by more than about 10 beats per minute. Special cautions necessary if you have a history of cardiovascular or cerebrovascular disease, had a stroke, had a heart attack before, you're dehydrated, you're taking antihypertensive medicine. Symptoms of this orthostatic hypotension could be you're dizzy or you're lightheaded, all from a fall in your blood pressure, change in your heart rate when you stand up. Well, it can cause some metabolic changes. It can cause problems with the blood sugar, cause the development of diabetes, sometimes weight gain, alter cholesterol, alter triglycerides. Typically, the change in blood sugar is detected on a blood test. It isn't because you develop signs of diabetes. Usually that's very late in the story of diabetes, when people have excess drinking water or urinating or eating extra and they seem to be losing weight. That's not what we're talking about. We're talking about the chemical diabetes, where the blood sugar goes up to more than 126. Happens in about 13% of people. So in about 1 in 8 people taking the 40 milligram dose, sort of a standard dose, they might have the development of diabetes. Diabetes obviously can have significant impact on heart function, kidney function, eye function down the road a piece. Seems to be more common in schizophrenia than in bipolar disorder. Seems to be more common if you have a family history, if you're obese. Cholesterol can go up to more than 240 in about 10-15% of people. Triglycerides go up to more than 200 in anywhere between 10 and 40% of people. Those changes more if you happen to have schizophrenia than if you happen to have bipolar disorder. There's minimal weight increase, but still about 3% of people. So about 1 person in 30 or thereabout going to have more than a 7% increase in the initial body weight. So that obviously is quite important. Maybe all of those numbers are somewhat less than some of the other atypical antipsychotics. May cause the neuroleptic malignant syndrome. Now, this is not a cancer. It has nothing to do with cancer, but it has to do with a high fever and muscle rigidity, a change in your mental state, cause some muscle breakdown, rhabdomyolysis, cause some myoglobin from the muscle to get into the bloodstream, and then it clogs up the kidney and you get acute renal failure. Drug also might cause dystonia. Dystonia with prolonged abnormal contraction of muscle groups, susceptible individuals, usually within the first few days of taking the medicine, spasm of the neck muscles oftentimes, can progress to tightness of the throat and some swallowing difficulties and difficulty breathing, and you stick your tongue out, it protrudes, especially at increased doses. And if you have Parkinson's disease, or if you have the dementia of Parkinson's disease, we call that Lewy body dementia. It seems that people are increased in their sensitivity to the atypical antipsychotics, and they can develop confusion or obtundation, lack of mental alertness, and postural instability, and they frequently fall, and they can develop some slowness of movement and some drooling and some muscle rigidity. And a recently published report with the atypical antipsychotics shows that they might impact negatively on kidney function and cause the creatinine, which is a blood test of kidney function, to become elevated, and in some people go on to acute urinary retention and hospitalization for kidney problems, and even a 2-fold increase in mortality. Other side effects, well, of course, somnolence, feeling tired, 15-20%, restless, 15-20%, nausea, 10-15%, vomiting about 10%, and those extrapyramidal symptoms up to about 20%, with slow movement and drooling and muscle rigidity and having what we call the ocular gyrate crisis, where your eyes just are sort of fixed in an upward gaze, and developing tremor. About 1 in 10 develops insomnia. Some people develop runny nose or rhinitis. And then some people develop a peculiar abnormality of the esophageal motor function. So the esophagus doesn't work right, which means you have a higher incidence of developing aspiration pneumonia. The food goes down into your lungs instead of going down your esophagus. And people have an increased incidence of falls because of that postural hypotension and the muscle instability. And people can develop seizures, new onset seizures, if they're taking the medicine. Especially in people who have a decreased seizure threshold, like in people who are elderly over age 65 or people who have Alzheimer's disease. And the drug certainly affects the central nervous system, and because it affects the central nervous system, it could have cognitive or motor impairment, impair your judgment, impair your thinking, so caution driving a car. And it can cause temperature dysregulation in your body. So it can cause a difficulty lowering the core temperature, which is important in the summertime when it's hot and humid, or if you have you're performing a lot of exercise, or you're taking certain medicine even like Benadryl that has an anticholinergic activity, or if you're dehydrated. And in some people, it can cause mania or hypomania. Now, if you're going to stop the medicine, the British National Formulary, they say, do it gradually. Don't come off all at once, otherwise you might have withdrawal symptoms. Withdrawal symptoms tend to be relatively mild: nausea, vomiting, loss of appetite. Some people get restless or insomnia or have some numbness and tingling of the extremities or even muscle pain. And some people develop for the first time psychoses, hallucinations or delusions. How's the medicine work? Well, we don't really know how any of these medicines work. The theoretic reason is it's an antagonist of the dopamine receptors centrally, the D2 and the D3 receptor, and it seems to work against the serotonin receptors, the 2A receptor and the 7 receptor. It doesn't work against the serotonin 2C receptor. That's why it doesn't seem to cause too much weight gain. It also works on the norepinephrine, but it doesn't have anything to do with histamine, or it's not an anticholinergic. Medicine, about 10 to 20% of it's going to be absorbed once you take it by mouth, steady state in your body after about 7 days. The half-life of the medicine, once it's in, half is going to come out within about 18 hours. Might be as long as 20 to 40 hours according to some, but most people think it's about 18 hours. Peak serum concentration is going to occur 1 to 3 hours after you take the medicine, and about 99% is going to be bound to proteins in your blood. It's going to be metabolized in the liver, going to be metabolized to several dozen metabolites. 2 of them appear to be active. 1 of them reaches clinically relevant concentrations. It's excreted about 80% in the feces, about 20% in the urine. Has minimal interactions with either lithium or valproate. But now remember, we talked about the prolactin, well, at least as far as animals are concerned. Indeed, it does raise the incidence of malignant mammary tumors in mice and in rats, and it also increases the incidence of pituitary gland tumors. Well, is it safe for pregnant women? Well, if a woman takes it in the 3rd trimester and then delivers, well, the newborn has a greater risk of showing some withdrawal symptoms or having some musculoskeletal problems. We call them the extrapyramidal symptoms. So agitation, the muscles could be flaccid or hyper-rigid. We can have fever or tiredness, respiratory distress, difficulty feeding, varying severity. Tend to resolve either within hours to days, but could be prolonged. There's no information about birth defects or about miscarriages, but we know that there's a significant background rate. So 2 to 4% of pregnancies associated with major birth defects, and 15 to 20% are associated with miscarriages without any drugs. Lactation hasn't really been studied, but we know that the medicine is in the breast milk. Has it been studied for other conditions? Yes, it was thought at one point in time it might be good for the irritability associated with autism. Hasn't really been studied well, but one study, another one of these 6-week trials, looking at about 150 people between the ages of 6 and 17, with the irritability of autism, found that it didn't really have any benefits, but it was associated with vomiting in about 1 in 4 individuals. Now, is it safe for young people? We can tell you that from some juvenile animal studies that it has effects on growth and neurobehavioral development. And it appears to be dose dependent, so we can have a decrease in the length of the femur, we can have a decrease in the bone mineral content, a decrease in the brain weight, a decrease in the body weight, motor hypoactivity, and it appears to interfere with sexual maturity because it decreases the estradiol, the female hormone. Well, it's not a drug of abuse, so we don't have to worry about that. You can overdose on the medicine, and then you can get that dystonia with the muscles of the neck and the tongue. You can have some of the obtundation, the lack of mental alertness, and some seizures. And a special problem, if vomiting occurs, you could develop aspiration pneumonia, where the material goes down into the lungs. So we need to evaluate people for cardiovascular irregularities, especially if they overdose and they were taking medicine for their heart, like Norpace or procanamide or quinidine. Now, Latuda itself is manufactured by Synovium. That's out of Marlborough, Massachusetts, a U.S. subsidiary of a Japanese company called Sumitomo Dai-Nippon. The medicine was first made in 2003. Structurally, it's pretty much like Geodon. The chemical profile seems to be pretty much like Invega and Risperdal. It seems that not all of the reports are favorable. So we have Dr. John McClellan in the Journal of the American Academy of Child and Adolescent Psychiatry. He said that finding something statistically significantly better doesn't necessarily mean that there's any clinical relevance, especially in studies funded by drug companies. So it seems that the percent responders in bipolar depression with Latuda could be as high as 60%, placebo almost 40%, remission with the drug about 26%, about 19%, with a placebo. So according to him, 6-week study at best provides minimum advantage over the placebo. Both of them seem to be mildly improved, but we haven't really cured anyone. This is sort of a temporizing measure. Now, in spite of what people talk about a lack of research, lack of money available for research, let's talk about how much money Big Pharma spends to advertise on the television. Well, in 2018, they spent $3.7 billion. That's almost $4,000 million on television advertising, and that's up from $3.5 billion that they spent in 2017. Now, for a while, Synovium jumped into second place in 2018. They were among the top 10, depending on which particular month we're talking about. Well, actually, they spent $120 million on one ad that they repeated for a period of 21 months. And in just October of 2019, the company jumped into third place with $15 million in marketing expense just for the 1 month. If we look at the top 10 major pharmaceutical companies, just the top 10, in 1 month time period, they spent $165 million on television commercials. That's why every time you turn the television on, it seems that they're advertising another drug. And they complain that they need to have high prices because it costs the research. It costs for television. Well, not all doctors prescribe the medicine, but sometimes the drug companies find somebody who's peculiarly interested in the drug. So in Dollars for Docs, published on ProPublica's website, you can go to that just on your computer, the top prescriber in the United States was Dr. Alex Pinkozevich. He's a psychiatrist in Brooklyn, and he prescribed the medicine and has about 3,000 Medicare claims. Now that's significantly above all of the other people prescribing the medicine. Is he an expert in the area? Well, if you go to Medline, which looks at all of the published articles in the medical literature, his name doesn't appear. He hasn't written any articles that at least I can find. Now, Dr. Pinkozevich, he received about $31,000 from the drug companies in 2018. 2017, he received $24,000 from the drug companies. In 2016, he received $26,000 from the drug companies. 2015, he received about $28,000, and in 2014, he received somewhere around $53,000. Now, you want to know why doctors prescribe certain kind of medicines and why doctors seem to go and promote the medicines? Well, you make the connections. Anyway, the cost of the drug, if you want to go over to Costco right now and buy 1 month worth of Latuda, and you want the 40 milligram pill, and you have cash in your hand, it will cost $1,414. That's how much a month worth of the drug costs? That's more than $45 a pill. You can go to other drugstores and you can find that the drug, especially at Walgreens for cash, is over $1,500. And if you have a coupon from GoodRx, you could get it for around $1,250, except Walgreens. Again, they're the most expensive. That's more than $1,300. Well, how's that compared to some of the other atypical antipsychotics? Well, a month worth of Rexulti is $1,100. A month of Vraylar is almost $1,200. Safras, $1,200. If you want a shot of Invega that you only have to take once a month, that's going to cost you $2,600. These are significant amounts of money, obviously. If you want the 3-month shot of Invega instead of the 1-month shot, the 3-month shot is going to cost you more than $7,500. Well, let's say instead of taking the latest, greatest medicine, you take a standard medicine. You take the generic version of Seroquel. $11 for a month. Risperdal, $11 a month. Zyprexa, generic version, $13 a month. The Abilify, the generic version, $18 a month. The Geodon, $31 a month for the generic version. That's the story of Latuda. It's not a spectacular success, but it is a spectacular cost. It doesn't seem to work really any better than the older versions of the medicines that we have available in the same family. But the generic versions of the older medicines only cost about 1% or 1/100th of the price of Latuda. $45 or more a pill? You gotta be kidding. But the company says, hey, you know, that's a steep price, but we'll give you a copay card. And you can take the copay card and you won't have to pay anything, no out of pocket. We'll just rip off your insurance company. Well, you gotta be careful about that kind of thing. So anyway, thanks for watching. If you enjoyed the show, please subscribe, maybe tell a friend. If you subscribe, you'll get the new shows as we post them. I appreciate your interest. I'm Dr. Ken Landau.